Good evening, ladies.
Hello.
Hello.
Good evening.
We have Dr. Ojo Cairns of Evotion Gynecology. We have Erin Glace, whose face you might recognize from past videos that we've done, past webcasts. If you missed it, you should go back and check it out. She is a pelvic floor specialist with over 25 years of experience treating women with pelvic floor problems, a wizardress among us. And we have Danielle Stern, who is co-founder of the BOV Brigade, whose mission is to make more affordable and accessible yoga for people in Hampton Roads. So I personally love Danielle as a yoga instructor, and so I'm just so excited to have you guys all here together. I know I've heard about Mula Bandha, which is the root lock, and I know I've heard Erin, from you specifically, and Dr. Ojo Cairns from you as well, the importance of the pelvic floor. What is Mula Bandha or root lock?
Well, Mula Bandha being root lock is one of the energy centers. So in sort of the more Eastern medicine, Chinese medicine, and yoga philosophy that informs the physical practice of yoga, we often will look deep into what we call like the energy body or the subtle body, depending on which yoga framework, which philosophy you're working with. And that feeling of the different energies, it's very metaphysical, right? Sometimes it's hard to get into that headspace, particularly. I mean, I know there's a couple of us here that are, we're academics in our own right, in our own fields, and we live in our books and we work with our students or our clients and our patients, and they want, real world expertise as well as evidence-based methods. We want to provide that to our students, to our clients, to our patients and folks that we work with and teach. But sometimes something that we are feeling, it's hard to describe, but it's just as when I teach writing to my university students, it's one of those things that we learn by doing. And so practicing makes practice. Not practice makes perfect, but practice makes practice. And so working with the energy centers, even though it might sound a little woo-woo and a little out there, and we have to think, how do we have centers of energy in our body? One of the things that, I struggle with is meditation. And so when I have a yoga teacher or a meditation teacher say, oh, just practice, I do kind of tense up. So I understand what it might sound like, oh, find a comfortable seat and kind of tune into your body. But one of the things that we might be able to talk about throughout our time together here, if we get to like a very brief moment to maybe practice, is tuning into your body to really listen, to feel where might you have some tension, where might you feel a little bit more open. And that's like a good starting place to understand the different energy centers that move along from the base of the spine, which is the root chakra, if we're using the energetic language, all the way up to the crown chakra. And then there's other centers along the spine between those, I think, 7 points from root to crown chakra, that if we can really focus on that feeling of energy and things that might be a little locked up or that might be free flowing, the goal is to try and find kind of balance. And so as we talk tonight, maybe about some of the different pelvic floor strengthening activities that might think about, how does that help open up some things that might feel a little like stiff. Maybe that's a good starting point.
I 100% agree with everything that you just said, Danielle. So my experience with yoga, I was a physical therapist, a pelvic floor therapist prior to getting into yoga. And one of the things that I loved that just made me so passionate about yoga was how the things that I was talking to my patients and clients about in physical therapy were so similar with yoga. So when you're talking about finding that upward energy in those kind of 7 levels, I do the same thing with my patients and talking about the connection between the physiological connection between the pelvic floor, the respiratory diaphragm, the glottis. And so there are definitely these diaphragms that do create this kind of inner balance and strength. So while I would reference that as like the deep core structures and really kind of come at it from this anatomical, the respiratory diaphragm is a muscle that contributes to breath, but it's also a core stabilizer. And I think that's like a mind-blowing moment when we realize that this muscle that we kind of just attribute to breath actually creates stability. So yoga to me has been for myself personally, and I always talk to my patients about the fact that I do yoga-based exercises with them, and anybody who yoga kind of feels good to, and like that's something that they can go into and feel comfortable with, I so encourage it, because it really does connect you to the center. And so again, that connection to the center, I think, is a beautiful way to say what I will often say is improving your sensory motor awareness. And because you can't see the pelvic floor or the Mula Bandha, the root lock, you have no visual of that. It really does become that sensory motor or that connection. So
I love how we have different vocabularies. Well,
exactly.
I'm so sorry to interrupt you.
No, I love it.
But the vocabulary is around that very similar experience, because what you're describing about, I think you used the phrase sensory motor experience. There's a version of yoga that I'm not trained in, but I've read a lot about and have practiced as a student that I think is very relevant here, which is soma yoga, somatic yoga, that really tuning in and listening to your body. And I feel like we're probably engaging in similar activities with our clientele and with our students for different reasons.
Absolutely. And the language is exactly, again, what kind of drew me in. So when I was in a yoga class, when I first I found yoga through YouTube yoga. And it was also, as you have in your biography, in a very stressful time of my life. And I was just like, seeking something to kind of get me out of my own head, to kind of allow me some space. So I actually found it through YouTube. There weren't a lot of yoga studios in my area. I live in Western Branch, and when a yoga studio did open up close by, River Yoga, which unfortunately is no longer here, I was there first day with my daughters, pulling all my friends in, and that's where I ultimately did my yoga teacher training. But when I was in the class and just kind of heard the words that she was using to teach us to engage those muscles, I just flipped. I was like, and I started using those words in my professional PT practice because it meant something. It allowed me to really connect in that way.
And related to Muladhara, which I may have earlier referred to Mula Bandha, so I want to be clear about how that connects to the energy center as well as the anatomy and pelvic floor that we'll talk about a little bit. When I'm talking about the kind of energy centers, and I use the word Muladhara, that is that base root chakra. So sometimes you'll hear yoga teachers or folks that are using that kind of energy medicine to say root chakra. Other times we might say the base chakra. And when we're referring from Muladhara as that particular root chakra energy center, when we engage it as a yoga student or as a yoga teacher and we're leading a practice, whether you're seated or standing. So there are ways that you can, from seated or from a reclined position or standing, really bring your awareness to that base energy center. And there's ways that we can kind of pull that energy in physically as well as kind of emotionally, energetically, and not holding the breath, but kind of holding that energy center at the base and then trying to kind of draw up through the core. I know Erin was mentioning core engagement, or you didn't use that particular phrasing, but you're talking about core. And that's, I think, one of the interesting things about Muladhara or Mula Bandha. That was the next phrase that I was going to get at, when that practice of engaging that root chakra and trying to draw up through the energy center. Mula Bandha is that particular kind of breath and energy practice. What we're finding, and when I say we, it's not, yes, there's studies out there. I'm not studying this in particular, but when we're discussing this or practicing this, it's not just a focus on that root lock or on the pelvic muscle, but when you pull that kind of energy center in at the base, lengthen the tailbone, you're then recruiting your core muscles. And again, whether you're reclined doing some of this work, or seated or standing, right? The different levels, different things that folks have available to them, and time too, and sometimes space restraints. There's different ways that as you focus in on that base center, you can't just focus in on that root chakra, on the pelvic floor, because as you lengthen the tailbone and recruit the core muscles and everything else is engaged, it becomes more complex than it is. But that's the magic of the body, right? When you focus in, it can work together if you kind of get out of your own way.
100%.
Not to say that it's easy.
It's not easy. That is also very accurate from the physical therapy kind of anatomical. We know that the pelvic floor is a partner. We call it an agonistic muscle that works with the deepest layer of the abdominal muscles, which also has that interconnection with the respiratory diaphragm. So this kind of Eastern yoga tradition is so interesting to me, how it's all wrapped up in what we know, how function works, how the body works functionally. And again, my mind was blown as I was in these classes, and I was like, this is what we're doing. This is what we're trying to teach our patients who have, physical ailments that they're coming to see us for. We connect back and build that kind of center strength so that you can then move from that center.
I love, Erin, that you mentioned kind of the deep tissue, that area. And as I continue down a journey of advanced training and teaching yoga and wanting to be able to respond to more students' needs, where I feel like students are more willingly acknowledging, yes, I'm looking for a slower practice or a more mindful practice. Not that there's anything wrong with so many folks that come to yoga to practice flexibility and mobility and becoming physically stronger, and some of the other kind of image-based yoga that sometimes is critiqued. But still, there's wonderful practices to still come out of that type of yoga. But I am noticing the last couple of years, particularly during the pandemic with so much chaos, that kind of mindful, kind of going deeper type of practice. And so bringing it to that kind of that deep tissue that Erin mentioned, the same thing with focusing in on like the energy centers, that's going deep, that's deep energetic work that then eventually, as you continue to practice, does benefit the mind and does benefit other areas of the body. But it's being able to give yourself some time and the grace and patience to not be hard on yourself. Can I feel these deep inner muscles? Likely no, right? But when you engage the outer muscles to help recruit those inner muscles, you can kind of listen. So yeah, I don't want to say it's impossible to really feel those deep muscles. I don't have that much body awareness, and I'm a yoga teacher. So
And Dr. Ojo-Cairns, what does it look like from your end? Are you able to, on pelvic exam, tell if someone is engaged with these things, or how does this translate into the vocabulary that you know and work with?
Well, I think, yes, I'm able to tell things are engaged during a pelvic exam, but I think more so, and it's great hearing all this, because having a sense of self, inner self, understanding your inner self and being able to center does impact your ability to deal with just all ailments, specifically what we're talking about is the pelvic floor. So if you think about women with endometriosis and the type of pain they have that central sensitization of pain. They feel pain more increased than other women who don't have endometriosis because of what they've been going through, the chronic type of symptoms that they've had. And so having the ability to really understand what those pain centers are, that energy is, where it's coming from, and how to move energy from one place to the other. If you talk about what science is, energy is transferable from one place to the other. Energy doesn't end, it just continues around. So placing that energy in a different place or receiving it in a different way would help someone to deal with that type of pain, or to at least lessen the pain that they do feel. I also think that this is a great topic to discuss, because it's one in which we remember that, there is Eastern medicine, there is Western medicine, but there's just care for yourself. And so we all have our history of where we received our medicine, or where we received our healthcare, and what type of healthcare we received. But it all goes into one. We're all human, no matter where the medicine comes from. So understanding, being able to center yourself does help to release endorphins, which would help you to be able to deal with the pain that you have with. Being able to center yourself will help you to release and get rid of those toxins that are built up in your brain that stress can increase, to help you feel better. And so even though, medicine has different terms because it comes from different places, we also have to just think about what the whole purpose is. And the whole purpose should be to help us feel better, to help us live better lives.
Love that.
Mhm.
Absolutely. Absolutely.
So how do we know if we're doing it right?
From my perspective, from like if you go to like Dr. Ojo Cairns does, I can do a pelvic exam. So when we're talking clearly from like a functional standpoint, there are definitely ways that we can help our patients and our clients to learn how to feel that pelvic floor, how to feel those deeper muscles and that connection. And oftentimes it is just kind of bringing the brain's awareness to that area. So much of our days are spent in our heads where we're like, what's the next thing I have to do? What's the next thing I have to do? And this, I think, clearly piggybacks off of Dr. Ojo Cairns' statement about kind of treating the body and allowing some stressors to release when we step out of our head for a moment and check in with our bodies, we become much more aware, and it's kind of training the brain. And so you can train the brain to kind of engage those muscles. And like Danielle was saying earlier about just the awareness and feeling the muscles activate. It is a neuromotor retraining, kind of like bringing your brain to a sense of awareness in a repeated way helps you to then identify. And we know that then those muscles kind of fire on their own, or they begin to activate on their own. And we talk about like the global support system, the global group of muscles versus the inner kind of deep core of muscles and the different kind of actions that they have. So again, very much piggybacking off of the yoga tradition of that global and the deep. We have that same, we know this from research and studies, that's how our body works. So you can find that awareness, and oftentimes it is about just bringing your brain, this is my pelvic floor. And so dealing with patients who are in pain or who have dysfunction, then we have to bring their awareness to that and teach better control. Also, like Danielle was talking about, like slowing down, like I say that all the time to my patients about prescriptive exercise. And so prescriptive exercise is addressing something that's wrong with the patient. We determine through evaluation. Dr. Ojo Cairns and I work with patients together, and she'll identify, and I'll jump in and kind of we'll work together to say, okay, this patient has a pelvic floor dysfunction. We teach prescriptive exercise, and oftentimes that involves slowing down the pace of what they're doing, not going through, not trying to get 100 crunches that are really poor form and not using the right muscles, but slowing down and making it more mindful and teaching them how to find those muscles. I think we can find those muscles. It just takes being mindful.
And I think this mindfulness also helps in regards to helping the body to recreate some of these systems that have been created to increase pain. So what I'm talking about is neuroplasticity. And so if you change the type of stimuli that you have, or you change your perception of that stimuli that you have, this noxious stimulus, whatever that is causing the disruption or pain, if that's stopped or the perception of it is changed, then that can help the body to recreate nerves and neurons that will then fire in a different way, in a way in which pain is not being perceived as much as it's more touch or stretch. So, again, all of this does work together, and it really proves to this point, there's not just one quick fix in it. there's not an ailment, there is not a condition, there's not a disease, there's not a process where you have one quick fix. You have to put your work in. And so part of that putting your work is understanding your body, realizing what your body needs. And when I talk about your body, not just your body in your pelvis or your body in your pelvic floor, but your body in your brain also. And so we come back to learning how to recenter, learning how to focus, and making it a part of your day.